Yeah, and what was the, when they said your diabetes is not responding to running or getting worse? I mean, how did they determine? Did they say your hemoglobin A1C was remaining up, your glucose is up, or were you seeing actual damage occurring? Whether it's blood pressure or kidney issues or anything like that. How did they make that
Well,
decision?
I had this sort of diabetic retinopathy, which was disappointing because I felt like especially in that first year, I thought I'd really thrown myself into it and done everything that was asked of me, and I hadn't had it the year before, and then of course then it was saying that I did have it 12 months or so after diagnosis. I had a little tingling feeling in my feet, but that had been going on for quite a while, and I didn't really. It's an interesting thing with diabetes because it's a lot of little things that sort of up on you, and you don't really pay too much attention to it. So yeah, my condition was. It seemed to get better initially, apart from the diabetic retinopathy. It seemed to get better, but then they said by the time we got to 2016, 6 years later, they said, "Well, your cholesterol. We're not happy with your cholesterol. We want to put you on statins. The medication that you've been on up till now doesn't seem to be doing enough. Your numbers are starting to go. Your HbA1c is starting to go back up again." And I remember saying to the nurse at the time, saying, "I'm doing everything I can. I'm following what you're telling me to eat. And we're all told that we're supposed to do 150 minutes of prescribed moderate exercise a week. I'm doing way beyond that with all the running and everything that I'm doing, but my condition is getting worse." And they said, "Well, we always told you it was chronic and progressive." So I felt a bit powerless at that point.
Yeah, that's got to be frustrating. Your observation that this is this little slow, and it is a slow progressive disease for people that don't sort of treat it correctly. And I think nutrition is probably the correct treatment. But you see it, your feet's a little bit numb, you'll blow it off, and then maybe you have some aches and pains that you just contribute to. Maybe it's aging, where maybe it's actually glycation of tissues, and on and on and on, and you see these things. So now how did you get to, 2016, diabetes, we're 6 years on. When did you make a you saw Mosley talking. So how did that go? Because, obviously and again, I don't know what your dietary switch was, but I assume it was something that was not going to make your cholesterol better according to conventional doctors. So how did you make that uh, leap, and how did you deal with the
Well,
concerns around what was going on?
it was a leap of faith, really, because but then I felt like I had nothing to lose because I thought I've got a condition that's getting worse. So whatever I do from this point, what difference is it really going to make? They're only going to be increasing my medication anyway. And Michael Mosley had brought out a book, and I said to my wife at the time that I'm going to get the book. I'm going to follow what it says in there, and I don't care whether if the food tastes like cardboard, I'm not. I'm just going to follow it, and just see what happens. And being in the kind of the role I am, I like a spreadsheet, and so I was working out all my numbers. I hadn't really paid a huge amount of attention to things like finger prick tests, glucose tests, that type of thing. I hadn't really had a proper formula when would be time to do it. So I looked at it and sort of thought, well, I'm going to test before a meal, I'm going to test in the morning, I'm going to test after a meal, that type of thing. And so I knew what my numbers were at the start. But the thing that amazed me was that he pretty much was turning everything that we've been told on its head. And whereas I was being told that, I had to base my meals around all these starchy carbohydrates, um, he was saying, well, actually, no, that was the thing that was leading to the condition to being chronic and progressive. And actually, the foods that I've been avoiding, so the things like um, higher fat or normal fat, I would say, normal fat type products. Whereas I've been told you've always got to go for the low fat versions of things. He was saying, no, actually embrace that, enjoy that in your meals, and don't be worried about things, eating eggs and meat and fish and those types of things. Enjoy it. So I thought, well, I've got nothing to lose. Let's go for it. I had a different diabetes nurse by and I spoke to her, and she said, go for it. Keep me updated. She said, because one of my other patients has tried it and they've had a lot of success. So I thought, great. And that was all the incentive I needed. I had somebody now who was actually giving me that kind of push to go for it. Um, so I did. I got my spreadsheet. I was working on my numbers. I couldn't believe that how quickly things changed. I mean, in that first week, I lost 9 pounds in weight. I mean, I know clearly some of that's going to be water weight, but it's incredibly motivating when you're seeing that your weight is starting to come back down again. And my blood sugar levels dropped down pretty quickly. It just those first few days. And by the end of the week, I was getting readings of early fours, that type of thing, even late threes. And I thought, well, I need to chat to my nurse and ask her, what is this okay? What should I be doing? And she said, you don't need the medication anymore, which was incredible. I mean, even now I still think it was a stunning feeling at the time to think that my meds were going to go up, and then within a week I was coming off them.
Yeah, that's gotta feel good, and I think the observation made, which I think is wonderful, you said these things are normal fat, everything else is low fat, and I think about it, it's like normal fat, a whole egg, a piece of meat with the normal amount of fat that comes with it naturally, fish, you know, uh, you know, those types of things are normal fat, and then we have everything else is low fat, or we have high fat, where maybe you would say these oils that are processed, maybe concentrated creams and butters would be higher fat. But I think when you talk about normal fat, it's like a whole food, like we've been eating for, gosh, who knows how long. But so now you're off. You come off the What medications were you on, by the way? You didn't mention the name of the medications. If you want to share
Uh,
that.
metformin,
So,
metformin. So I was on 2 metformin a day at that point, and they
okay.
wanted to increase the metformin.
Okay, so still relatively early in the disease,
Mm.
fortunately, and, there's some diabetics that are on, I mean, 4 or 5 different medications for, I mean, several for diabetes and then a bunch of other medications with blood pressure, cholesterol-lowering medications, and blood thinners, on and on and on, which is kind of a typical presentation for a lot. Um, so you lost 9 pounds. So what about the retinopathy? Did you ever follow up on that? Did you see Was that able to improve at any one point?
We get tested every year. So yeah, we got to a point after a few years where I started getting tests saying that there weren't any issues. So it was starting to prove, and it gave me that kind of confidence that everything was going right and it was going in the right direction. But even now, I still get tested. But it's interesting what you were saying, just picking up on what you were saying about the normal fat. I mean, here in the UK, and I assume you get this in the US as well, is that we've got like traffic light systems on foods, and you think of something like a piece of fish, and it will have fat content on it, and it'll be in red as if like this is something to be avoided. And so you do feel, and with people that I speak to now, there's still that kind of almost like a hesitation. Am I doing the right thing? Is this going to lead to me having worse cholesterol? Because everyone seems to get worried about cholesterol. So yeah, it does make you stop and think, but then you always get to a point where you think you've got nothing to lose and let's go for it.
Yeah, I think, and just to so what happened with your cholesterol? Did it go up as you increased the fat in your diet? What was the effect that you had?
My total cholesterol went up.
Okay.
Yeah, my total cholesterol went up, but my HDL doubled and my triglycerides came down really quickly.
Yeah.
So we're able to sort of go back and have a look at our numbers and things before. So I know around the time my triglycerides were 2 at diagnosis, and I had mine tested now in recent times, and they're exceptionally low. So it's something like, I don't know, it was like 0.6 or something like that. It was completely different, but of course there was still that sort of feeling. I remember going back to see a different doctor about something else, because in the UK you don't always get to see the same doctor. And this was after putting my diabetes in remission, and they um, remarked on my cholesterol and said, "Oh, your total cholesterol's up. Has anybody talked to you about statins?" And I thought, here we go. Let's have a conversation then. And of course, when you do start talking a little bit more about it, you actually realize, well, to be honest, we're still pushing people on this total cholesterol thing, and people do get worried about that, and that can, I guess, it can make people hesitate a little bit before they do something, make a
Yeah.
change.
Yeah, certainly it does. And I think it's really important to point out the fact that, when you were, dealing with diabetes and you had higher blood glucose and lower cholesterol, you had retinopathy, you had microvascular disease that was being evidenced in your eyes. You switch to a diet where your cholesterol goes up, but your glucose goes down, and that vascular disease improves and gets better and goes away. So I think that's particularly telling, I think. And I think when we look at the data that I'm seeing now coming out of studies and women's health initiatives showing that the biggest risk factor for cardiovascular disease is diabetes. I mean, it's blood glucose issues, and cholesterol has a very minor role in that. And so I think, you're living proof of that very same thing because what's happening in your eyes is happening everywhere in your blood vessels. It's just we can see it easier in our eyes because we have this, neat way to look through, fundoscopic view of the eye, and we've got this window into our microvessels that otherwise is hard to see. So that's pretty interesting.